to the New South Wales outbreak gives us a lot of leads to chase down as quickly as we can. I'll now hand over to Dr. Bloomfield for an update.
Thank you, Prime Minister. Kia ora koutou katoa. So, some further information building on what the PM has said. Further to the 5 cases reported earlier today, there are now a further 2 cases of COVID-19 to report in the community, our total now being 7 cases, all of whom are in the process of being transferred safely to the Auckland quarantine facility under strict infection prevention control procedures. Separately, in our managed isolation facility, there are a further 3 cases to report today, and the details of them will be in today's statement from the Ministry. Turning further now to the community cases. Our first case, we will call Case A, that was announced yesterday. The other 4 cases announced earlier today include a work colleague of our original case, that's a 20-year-old male. There are 3 flatmates of that case, a 21-year-old female who is a fully vaccinated health professional that works at Auckland City Hospital and has been working in recent days. And as you'll be aware, there are measures underway to respond to that. There is a 25-year-old female teacher from an Auckland high school, that is Avondale College, and that college has been contacted, and the community will be receiving specific information about what to do to follow up testing and isolation, of course, for anyone who may have been in contact with that person. And the other flatmate is a 29-year-old male. There are 2 further cases that I'm just announcing, a 21-year-old female and a 19-year-old male, both of whom live in Auckland, and both who are linked to the current cases as friends, and who have spent time with one or other of those other cases. So in total, we have these 7 cases that are all linked. We are, of course, as I mentioned, concerned about the healthcare worker who worked 4 shifts while unknowingly potentially infectious. Auckland City Hospital was onto this last evening and took immediate actions in response, including preventing unnecessary movement of staff between wards, extensive testing of staff and of patients on the ward where this person worked, and of course preventing staff members who worked the same shift from coming into work, and they are isolating and being tested. The wife of our original case, as reported yesterday, and who is fully vaccinated, has returned a second negative test at this point. On contact tracing, our public health teams around the country are supporting rapid interview of cases, identifying close contacts, tracing those contacts to ensure they're in isolation and getting tested. Isolation when in alert level 4 means isolating separately from other household members. So they're being supported to do that. As at 11 a.m, Auckland Regional Public Health, our ARFS service, has identified 16 close contacts. 14 of them have already been contacted, and the other 2 are being tracked down. Just talking to the clinical director of the public health unit in the last hour or so, no issues with compliance. People are easily contactable and are already doing what would be expected of them in alert level 4. Those who have been contacted are isolating and testing being arranged at the appropriate time. 4 of those contacts, it is known, are fully vaccinated. 3 have had 1 dose of the vaccine, and the remainder are unvaccinated. Reflecting that we have a group of individuals here who are under 30 and therefore would not have been part of the wider rollout of the vaccination program as yet. We've activated our planned additional capacity for contact tracing, including our National Investigation and Tracing Centre here at the Ministry, and all the public health units are supporting Auckland Regional Public Health with case and contact follow-up. On locations of interest, as I said, most of the cases identified so far are in their 20s. They've been out and about a lot, and I'm flagging that there will be large numbers of locations of interest. It is very important that everybody keeps an eye on this. We endeavour always to